Hi guys, it's Brooke here. I have a super quick favor to ask. When you have a moment, please take just a second to give this podcast a 5-star review. This will help me to continue the podcast and continue to bring these resources to the community. Thank you so much for that 5-star review.
If we think of behavior as sort of the tip of the iceberg, right? The part that we can see, which is true, we see it. It's in our living rooms, it's in our
Mhm.
dining rooms, it's in our classrooms. But
Mhm.
underneath that tip is all sorts of things going on internally. Interoceptive cues, things going on in our body and our sensory system that might be triggering what we're seeing at the tip. And so,
Mhm.
unless we are addressing those underlying causal mechanisms, we are unlikely to actually diminish that behavior. So,
Hey there, it's Brooke, and welcome to Finding Hope on the Spectrum, where I have heart-to-heart conversations with parents, professionals, and autistic individuals sharing personal insight and life experiences. Together, we dive deep into supports, programs, and stories that offer inspiration, insight, and most importantly, hope for the neurodiverse community. Before we begin with today's topic, please take a moment to like, share, and subscribe to this podcast. And if you know someone who this would be helpful for, please pass it along. Remember to always stay curious, be kind, and have an open heart. Okay, well, I am so excited to get this topic going today. We are going to be talking about PDA and also the Neuro-Relational Framework, and we have an amazing guest. I actually, as we're recording, I'm just released an episode on PDA from a parent's perspective this morning, so this is an expansion on that topic, and I think it's just such an important one, and so grateful to get this information out here. And so I am going to start with introducing our guest, and then we'll get going. So today we have Jessica Richards, and she has over 15 years of clinical experience, advanced knowledge using the Neuro-Relational Framework, as well as child-parent psychotherapy training. Jessica has deep expertise in both top-down thinking, feeling, and bottom-up sensory motor work with families and individuals. Jessica holds a unique dual master's in clinical social work and child development. She is also endorsed in California as infant, family, and early childhood mental health specialist and reflective practice facilitator. Her diverse experiences range from inpatient child and adolescent psychiatry to community mental health in South Central Los Angeles. Jessica was the lead therapist for the Child Welfare Court Team Pilot Program, fostering family partnerships in Los Angeles. As a therapist, Jessica specializes in working with complex profiles. She has deep knowledge and experience in trauma, sensory differences, autism, pathological demand avoidance, selective mutism, and anxiety. With over 200 speaking engagements locally and internationally, she has enlightened countless child welfare, legal, mental health, and education professionals. She has been a keynote speaker at several conferences across the country and presented at 0 to 3 and the World Association for Infant Mental Health. So welcome, Jessica.
thank you. I'm really excited to be here and have this conversation. It's a really important one.
Wonderful. Well, let's get started with having you share just a bit about your background and what led you to specialize in pathological demand avoidance, otherwise known as PDA. I'd love to hear that story.
Yeah, so back when I started my career, pathological demand avoidance wasn't even something that was really talked about or known much. But what I will say is that my career really has always had this thread of intensity and complexity. So, I started working in inpatient child and adolescent psychiatry. That's obviously a very acute, very intense setting. Then I
Mhm.
worked doing in-home work in South Central Los Angeles. Again, there was a high level of acuity and complexity. And so it sort of was a natural transition. The complexity finds me or I find it. I'm not sure how it works in the
Mhm.
universe, but but it comes together and it really is, I think my forte is to hold all of that complexity and I really enjoy that kind of work. So pathological demand avoidance just sort of
Mhm.
rolled into what I already do in my practice.
Well, I love that. It's just what you're meant to be doing. And that's why I'm so excited to have you here as a specialist so we can really dive deep into what PDA is and, how it presents and also some really key strategies and tips. I'm excited to get to that part in our conversation. And I've had a few clients myself with PDA and it is quite a journey to support them and to learn about them. So I'd love for you to just start with, your view and your understanding of what PDA is and what makes it distinct from other autism profiles.
Yeah, so PDA or pathological demand avoidance or pervasive drive for autonomy, that's another reframe that also I think speaks to what this really is. So it is a drive for autonomy, the need, the intense need on a physiological level, on a nervous system level to have autonomy. So what it entails is having a nervous system difference that triggers a threat stress response in the nervous system whenever there is a demand or some sort of decrease in autonomy, something coming in sort of from the top down, sort of suppressing one's autonomy, whether that be direct and intentional or indirect and unintentional. Those sorts of suppression experiences of one's autonomy are what trigger these intense nervous system responses. And so that's really the underpinning of what's happening with PDA. Often it is sort of seen in behavioral terms rather than seeing it as this nervous system disability, really. But I think that is a mistake and will kind of lead you down a path that isn't likely to be terribly successful. I think probably your conversation with Stephanie, a parent with a PDA really highlights that those more behavioral approaches often spectacularly fail, even though they're really well intended. But understanding that nervous system piece is really key to supporting that PDA individual.
Oh, I think that's so important and we're going to talk about, that nervous system piece. And once we understand that, then that's going to drive how we respond and support these individuals. And so let's make sure to talk about what is this neuro-relational framework? I loved learning about it when we chatted previously. And I know you also have some fantastic handouts as well. And I'll make sure to include those in the show notes for our listeners to have access to. But if you could just touch on what this framework is and why it's so relevant when it comes to PDA.
So the neuro-relational framework is a framework that synthesizes what we have learned in neuroscience in the past 2 decades and really translates it into practical steps. Practical things that can be done both by clinicians such as myself. But what's so cool about this framework is it really is for parents, for educators. It's cross-disciplinary. It isn't just a mental health treatment model. It is a framework that can hold all different practices. So, what it consists of are three main components. And I think all three are really crucially important when we're talking about that PDA profile. So, the first component of the neuro-relational framework is understanding the stress and stress recovery system. So, that nervous system piece, understanding what is going on in the nervous system that might be driving some of these PDA symptoms or any emotional or behavioral challenge, right? Or any individual difference, right? So while it's useful for PDA, I want you to know it's broadly applicable across sort of diagnostic spectrum, but
Yeah.
understanding that nervous system is first and foremost. The second piece of the neuro-relational framework is really understanding what is going on in those relevant relationships. So parent-child, caregiver-child, and we know that relationships are crucially important for healthy brain development. And yet it's often hard to know, is it good enough, right? Is it, I mean, there's no such thing as perfect, right? But
Mhm.
is it meeting those developmental needs so that we can have healthy brain development? And so that is where the neuro-relational framework comes in, both as sort of reflective tool, are we on the right track? But also with a lot of intervention strategies for helping that relationship get on track. And then
Mhm.
the third component is really understanding individual differences. So in executive system, in our sensory system, right, in our emotion and meaning making system, in our body and physiology. So it's very broad and complex. And that's where we also end up bringing in relevant team members because often it takes a team, right? Often you need an
Mhm.
occupational therapist as well, or a speech and language pathologist, alongside maybe other work that you might be doing to support your child. So the
Mhm.
neuro-relational framework is holds complexity quite well because it is really addressing the nervous system, the relationship, and the individual differences. So one of the handouts that was provided shows all of this sort of mapped onto a tree, right? The roots of the tree
Mhm.
being the nervous system, the trunk of the tree being the relationship, and the branches of the tree being all those individual differences. So for those of you that are more visual learners, I encourage you to take a look at that handout because it'll really, I think, make it a little bit more less abstract as you're hearing this content.
That's great. Well, and I think that, what I was so significant is that this approach is so individualized and really getting to the root of what's causing, these challenges for these individuals, really understanding that nervous system breakdown and also the relationships and how important that is. And we know how meaningful relationships are and really, through research, what makes us happy and feel fulfilled in life is having meaningful relationships. And so that's incredibly important to feel like you are understood and you're of value and that your needs can be met. So I love what you just shared and how that really addresses those areas. And so I know in our field, we talk a lot about the nervous system terms, and you have specific terms that you use. And so let's talk a little bit about the autonomic nervous system, especially that sympathetic, which we know is the fight, flight, and the parasympathetic, which we know is rest and digest responses, and, how they what your viewpoint is with this neuro-relational framework. And also, I know you mentioned to me before that was really unique is that they could be activated at the same time. And that's something I had not heard before. So I'd love for you just to dive deep into that whole concept and what that looks like.
Yeah, so the autonomic nervous system, you can also rename it the automatic nervous system, frankly, because that's what it is. It's the part of our nervous system that responds without conscious or intentional thought. It just is what our bodies and brains do to respond to our environment. So
Mm-hmm.
within that autonomic nervous system, there is the parasympathetic and the sympathetic branches of the nervous system. So you can kind of nickname those the gas pedal, that would be your sympathetic, your fight flight branch. And then the brake pedal, which would be our parasympathetic, that is our rest and digest, as you said. So we call that in the neuro-relational framework, red zone is the gas and blue zone is the brake, right? So
Mm-hmm.
that's your more shut down, tuned out side. But
Mm-hmm.
you're absolutely right. Those two branches can also be co-activated. And that we call the combo zone. And that is where you see sort of a fear, panic, anxiety continuum. So, which all of us know is a very real state in our bodies. And it's not just an emotional thing, thought-based thing. It is a physiological thing that's happening in our body. When you are highly anxious, you are aware of all of those sensations that are happening in your
Mm-hmm.
gut, in your heart, your skin. All of those systems are activated. So, what that is reflecting is that co-activation of that parasympathetic and sympathetic nervous system. Now, it's a little tricky because one part of the complexity is that these branches are best thought of as operating as maybe levers rather than on off switches. So, for example, you could have your parasympathetic nervous system partially activated, right?
Mhm.
So you've got a little bit of a slowing down, but you could have your sympathetic nervous system highly activated, right? So they're both sort of co-activated, and that way you might see a combo zone that has more motor activity going on. So it might be a
Mhm.
child that is in the throes of, let's say, a separation anxiety distress, and they're clinging and flailing and lots of motor activity, right? That gas pedal. But we've
Mhm.
got also going on that brake pedal, and that is where you see that anxiety happening. So that
Mhm.
is a tricky layer of
Mhm.
complexity, but a really crucial one. And I'll also say that our parasympathetic and sympathetic nervous system, they're both good. And when they're in that just right balance, they give
Mhm.
us what we call the green zone. And that is our just right regulated state where we're able to learn, engage socially. So we actually need
Mhm.
both of them in that balanced state in order to function in our social interactions, in our community, in our home. And yet, no one is green all the time, right? We know from Kermit the
Mhm.
Frog, it's not easy being green. And these stress responses, this red zone, this combo zone, this blue zone, this is what our body and brain are supposed to do when we are faced
Mhm.
with a stressor, a transition, certain challenges. So I want to make it clear that it isn't pathology or signs of a diagnosis if you have these stress responses, but we do pay attention to when they are happening at certain frequencies, right? And certain duration and
Mhm.
intensity. So
Mhm.
we kind of differentiate, we call it adaptive stress when we're sort of below that threshold. Now, adaptive stress still doesn't feel good when you're experiencing it,
Mhm.
but it is truly adaptive. It is what our bodies and brains are supposed to do. Now, there's a
Mhm.
threshold that you can tip over where we are then concerned about the frequency, duration, and intensity of these stress responses. And
Mhm.
that is where often you do see sometimes then, a diagnosis or other developmental challenges coming about as a result of those frequent stress responses.
Mhm. That makes a lot of sense. And so that's, as I was thinking about this concept and this topic and clients that I've supported, just like with a traditional autism diagnosis, would you say that it's the case for PDAers that they can also have quite a spectrum of how their challenges present, related to these types of things that you're referring to?
Absolutely. So sometimes people ask me, well, which one of these stress responses is more common for autism or for trauma? And I kind of say any of the above, right? It depends on, again, the individual differences. So there are some individuals with PDA that their go-to stress response is more of that blue zone. They really shut down, they tune
Mhm.
out, they withdraw, they stop responding, right? They might even have periods of mutism as a result, where they're
Mhm.
unable to access their verbal language. But you might have other individuals who have a whole lot of gas pedal, and that is their
Mhm.
go-to stress response when they are confronted with threats to their autonomy. And so that might look like aggression, fighting,
Mhm.
tantruming, a lot of intense yelling, arguing. So there isn't
Mhm.
necessarily one way that it shows up, but that's why it's so helpful to have on your radar all of these different ways stress can show up in our nervous system, because
Mhm.
often we just look at sort of what we call like bad behavior, right? The fighting, the aggression, and we don't see that these other forms of stress are also
Mhm.
problematic when they're happening too frequently. Sometimes the more tuned out or shut down kiddo gets sort of
Mhm.
glossed over and thought of as kind of an easy kid, when in
Mhm.
fact, if they are stuck in that state, stuck in that blue zone, they are of no less concern or worry than a child that's stuck in that gas pedal red zone state. So
Absolutely.
sometimes that gets talked about as maybe internalizing profiles versus externalizing profiles. So
Hmm.
depending on sort of what that individual's maybe go-to stress response is, you might
Hmm.
see it labeled in that way, but it's part of that same underpinning of the nervous system at play.
Hmm. Yes, and I want to make sure that we just quickly talk about, you mentioned earlier why some traditional behavioral approaches don't work for these kids with this profile. And I just want to make sure that we touch on that.
Mhm.
And make sure that our listeners are really clearly understanding that, the importance of understanding that. Because when you see these kids that have these external behaviors, let's start with that for an example. It's easy for professionals that I've seen, at least for people to, or even just people in the community, to think they're just being naughty.
Mhm. Mhm.
They should be behaviorally treated to, support that behavior challenge they're exhibiting. And so I want to make sure, that we have a chance to really talk about why that traditional approach just does not work for what they're experiencing in their bodies.
Well, frankly, it doesn't work because it isn't meeting the underlying need, right? It isn't responding to what's going on in the nervous system. If we think of behavior as sort of the tip of the iceberg, right? The part that we can see, which is true, we see it. It's in our living rooms, it's in our
Hmm.
dining rooms, it's in our classrooms. But
Hmm.
underneath that tip is all sorts of things going on internally. Interoceptive cues, things going on in our body and our sensory system that might be triggering what we're seeing at the tip. And so,
Hmm.
unless we are addressing those underlying causal mechanisms, we are unlikely to actually diminish that behavior. So, let me just say, my goal is to also reduce red zone, right? Or blue zone or
Right.
combo zone. Whatever stress response is dominant, I want to see it replaced with more green zone, more opportunities for joy, for connection, for learning, for engagement.
Hmm.
But the way in which we go about achieving more green zone and less stress responses is not a behavioral framework. It is one that is about meeting those underlying needs, which might look like really doing a deep dive into the sensory system and learning what those triggers are that are might be causing and contributing to those stress responses. And then
Hmm.
also looking at what are the tools, what are the strategies, maybe within that same sensory system that help reduce that activation in the nervous system and bring about that green zone and that calm connection.
Absolutely. And so, for those that are listening, maybe a teacher or a professional, what would you say the subtle cues are that would indicate that, we're experiencing a nervous system challenge here?
It's a great question, and I'll answer it. And I also want to share with listeners that there are more in-depth tools with the neuro-relational framework that I think we'll reference at the end of the show as well, but that really dig into all of these physiological markers. So I think those are really helpful. But I'll give an overview right now because it's an excellent question. The tricky thing is that because we have these different stress responses, there's not just one sort of red flag, if you will, for a stress response coming on board. It depends on what dominant stress state maybe that individual is most likely to present with and sort of learning that individual profile. But in general, when you see a shift, often I would just say a shift in energy. Right? You kind of have this sense of like, ooh, we're connected, right? I feel that right now talking to you. I feel this sense
Hmm.
of connection. If I sort of shift in and kind of step back, kind of set back, kind of glossy eyes, sort of more tuned out, my body posture kind of slumps, maybe my muscle tone goes down, you would feel that shift in my energy, right?
Hmm.
And conversely, if it really gets very amped up, if I sort of have a frenzied quality, if I sort of have maybe really wide open eyes, you can see a lot of tension in my face. If my voice starts getting louder and faster, you could feel that shift in my energy. And that would be
Hmm.
an indicator I might be shifting towards a stress response. So
Hmm.
while I say there are tools and it's it's true within the neuro-relational framework with very specific physiological markers. I think my short kind of takeaway would be
Hmm.
just this energy shift that you can often really feel and sense. And there's sort of the gestalt of like, we're not really connected anymore, right? Like if you
Hmm.
think of a child who's maybe really frenzied, even kind of giddy positive, right? We're not talking necessarily always a negative, aggressive, combative response, but maybe that frenzied kind of giddiness, hyperactivity. You also
Hmm.
have the sense when you're in that child's presence, you can't connect. You might try
Hmm.
your best, but it's just sort of like they're in their own world in this really, I mean, happy state, but not
Hmm.
in one that allows for connection. So that's where
Yeah.
this gas pedal side can have a positive or negative valence, if you will. Sort of the
Hmm.
positive side would be that frenzied, sort of giddy, and the negative side would be that more traditional sort of fight, state that you see in that sympathetic nervous system as well. So
Hmm.
that would be my best sort of
Yeah.
takeaway, what to look for. It's an energy shift.
I love that. No, I think it's so true. And you can feel the energy. And as you were describing it, I was thinking of a client of mine that can be really, really connected. And then I might provide an opportunity for growth, a reflection, some feedback, just more in a declarative way. And you can see, it just was too much for him to process. And just like you described, it could be really quick. And all of a sudden you see, wait a minute, it's just, we're not going to be able to go there today. Like it's going to tip him over, and it's not worth pushing because it's not going to be of value to his learning opportunity. And so then we have to bring it back into focus on regulation again.
Absolutely. And that's such a good point that when we're in stress responses, those are not teachable moments, right?
Hmm.
If you're in a full-blown threat response, our goal is
Hmm.
to get back to green zone and then we can sort of readdress because that sort of white knuckling, forcing it through doesn't
Yeah.
work. But I
Yeah.
want to point out, and I believe this handout's also included, we operate with the notion of safety challenge threat. So
Hmm.
many people have probably heard of the idea of safety versus threat. And that again is speaking to what's going on in the nervous system. Is the nervous system receiving cues of safety, which allows for engagement, regulation, or is the nervous system receiving cues of threat, which would trigger one of these stress responses? But
Hmm.
remember, these branches of the nervous system are levers. So it's not a simple on off. So of course there's an area in the middle, right? Of course there's this,
Right.
we call it challenge. So it's not a full-blown stress response, but
Hmm.
you might have somewhat of an energy shift, right? Maybe it's not
Hmm.
that full sort of shutdown or that full sort of explosion and externalized response, but there's sort of a subtle shift, and that might reflect a zone of challenge. Now, what's tricky is that challenge is sometimes where our learning really happens and where our capacity growth really happens. But it has to be very carefully titrated, I say, or very carefully sort of scaffolded and supported and using co-regulation, using sensory preferences. Again, we're not talking about white knuckling it and just pushing through with an
Right.
agenda. We're talking about, ooh, I noticed a shift. Can we hang in there with this? Can we provide some sensory supports and continue forward? Or, and you might, try a bit in that way and then adjust. Either say, nope, not today. We're going to go back
Hmm.
to green zone and really shift out of that challenge state. Or
Yeah.
yeah, we can do this. We can operate in this challenge zone today. And I think what's
Hmm.
important to acknowledge is that all of this is dynamic. What is
Hmm.
possible today or this hour or this minute might be different later today, tomorrow, or next week. And that can be
Hmm.
so, I think, confusing for parents, for educators, because they say, well, yesterday they did it. Well, last week they did it, and now they're
Hmm.
not.
Right.
And the reason is because our nervous systems are dynamic. And they are the result, our capacities are the result of the cumulative everything in our environment, how much sleep we got, our nutrition,
Mhm.
all sorts of factors weigh in to what our current state is.
Mhm.
So back when I was a more green therapist, fresher, and where I would go into sessions with these, great ideas about what I was going to do and these plans. And, nine
Mhm.
times out of 10, that was thrown out the window in the first 5 minutes because the nervous system that I got in my office that day that
Mhm.
walked in wasn't at that capacity at that time, at that day, right?
Mhm.
So this really encourages us to be very flexible and really noticing, really detectives, if you will,
Mhm.
nervous system detectives to notice what is going on in any given moment so that we can gauge what that capacity is.
Mhm.
And not to make it even more complex, but here I will. I was listening to one of
Mhm.
your shows over the weekend. Oh, the maps. I'm blanking on his name, but
Dr.
the
Wooler.
yes,
Uh-huh.
and talking about that biomedical model and about all of the medical and physiological comorbidities that are often associated with autism and how much they can impact the quote
Mhm.
functioning of an autistic individual, right? And it
Mhm.
makes perfect sense. And when I was listening to this, I was like, oh, this is he's preaching to the choir because it's one of my soapboxes
Mhm.
that, these physiological conditions that are often underneath the surface have
Mhm.
everything to do with determining what's going on in the nervous system, which is the behaviors that we're seeing. And
Mhm.
so, again,
Mm.
if we're not addressing and thinking about that whole child, that whole person, we're doing a disservice.
This show is brought to you by Therapeutic Approach to Growth. Therapeutic Approach to Growth helps families with relationship and behavioral needs. Their holistic programs are individualized to honor and respect each family and their autistic son or daughter's sense of self through programs such as relationship development intervention, naturalistic ABA, and animal-assisted services. If you're finding yourself frustrated or discouraged with your current behavioral programs and would like to see more long-term meaningful growth for you and your family, then contact TAG today at www.tagforgrowth, that's TAGFORGROWTH.com, to learn more about how to schedule a consultation or how they can offer you the help your family needs, whether in person, remotely, or in a school setting. Again, that's www.tagforgrowth.com.
Yeah, I mean, that was just so well said. I love all of that. It was so great. And I think it's just a lot to even process and unpack. And, I think it's so incredibly important that we are mindful in the moment, as you mentioned, slowing down, noticing. We might have an agenda, but that agenda may have to go out the window, and that's okay. And what I love about it too is that it doesn't mean that when you try again or you make adjustments that the child is not going to be ready the next time. It just means you have to be really flexible and dynamic in the moment. And you mentioned creating these opportunities for growth. And I want to make sure that we are really, kind of talking about some of those strategies and approaches as well as we go through this conversation today, because I think that's so important to really have some good takeaways for professionals. And we're so like-minded, as we really have a similar mindset in RDI as well, very similar to guiding our parents to learn how to be in the moment and learn how to make those adjustments. And we call that moment where there is growth, productive uncertainty, where there's just the right level of challenge, but it's
Mhm,
productive.
mhm. Right.
And then I love this adding on this real deep understanding of the nervous system and the nervous system being available. And, I think that's just another added layer that's so important, and just grateful to have this conversation. So I'd love to talk about some of the strategies that you might use in your practice, or you mentioned scaffolding, a lot of terms, we use a lot of similar terms in our work. So, but a lot of people may not know those terms, or understand what that looks like. Co-regulation as well was another thing. And what does that look like when you're making those adjustments in the moment? So maybe we could just quickly kind of talk about some of the strategies that you use when you're in that moment of being a detective.
Absolutely. Well, and I will frame it more with PDA in mind, although these aren't exclusive to PDA individuals, but often I find that the use of humor is really helpful. It is a nice way to diffuse where I might be experiencing some escalation in a stress response, maybe because there was a challenge or perceived threat to autonomy. And using humor often is a really effective way to equalize sort of that and bring it sort of back into a more safe experience for the child. Novelty, introducing something different, something exciting, often is another strategy that's really helpful. And play is another one that's, again, just helpful and useful. And it sort of often integrates both humor and novelty, right? Because play isn't planned, it's imaginative, it's spontaneous. Those are some of the sort of go-to things that often are helpful. Sometimes it also just decreasing all of the perceived sort of suppression of autonomy. So that might mean talking less, really taking a real step back, getting really quiet. Maybe I'm just sort of offering some sensory strategies. So again, not even speaking, but what we call strewing, just putting things out. So my office, I have two huge baskets of fidgets, all sorts of fun things and slime and all sorts of things. And I might just kind of absentmindedly walk over, grab a few and just sort of set them on the table or put them on the floor next to them and walk away, right? It's not a demand, it's sort of an offer, but knowing that if I know that certain things help regulate that nervous system, I want to offer them and make them available. I also have a swing in my office. That's a really good go-to sensory strategy that for many individuals is just really calming. That vestibular, that movement input in the body is really calming. It's why, and that's an early sort of sensory preference, if you will. If you think about, an infant that's really dysregulated and experiencing all that red zone, inconsolable crying, what do we often do? We rock them, we swing them. Those types of movements for many individuals are really calming. And that's something that's preserved to a great extent throughout the lifespan. That movement is often really helpful. So adults even often will talk about the need to sway or rock or pace. And as a way to help calm their nervous system, it's the same type of strategy. So those are some of the things that are particularly helpful with PDAers. But again, this is so individualized. It's really about learning and noticing what that individual nervous system needs. And so, one of the things I love about my work, and one of the things that's also challenging, is there's no one size fits all. There's no session that looks like any other session. There's no formulaic anything, because every person is such an individual that it really is so distinct and so different.
Yeah, well, and I think that is so critical and so important. I'm glad you mentioned that, because you really do need an individualized approach in supporting these individuals, and it can be day by day that can change what their capacity is, as you mentioned earlier. One of the things that I've seen with one of my clients with PDA that I found to be helpful, which is an interesting process for me, but is to allow him to have choices and also allow him to talk about his special interests and just to promote that engagement and back and forth flow, and then be able to expand it from there.
Absolutely. Yeah. I mean, I should have mentioned both of those things, but that's just how I operate. It's all sort of, child-led in terms of interest, and absolutely sharing, a special passion or special interest is just the bread and butter of what I do and how my sessions sort of work and unfold. And I find it really, again, it makes no two sessions the same and encourages a lot of flexibility because those interests vary so much. But I always look for ways to weave in, whether it be questions that I have that then might need a response or a further explanation, right? A way to kind of weave in a relational component to that sharing. And so that is, again, a really critical skill, but one that is done within, their comfort area, within their ability. And so that's maybe a good example of, we mentioned the idea of scaffolding. It's sort of providing additional support alongside what the child is already doing and capable of. So it's not coming in and building a whole new structure. It's just adding some scaffolding sort of on the outside or some supports on what they are already doing and thriving in and enjoying. And that is often much more successful because you're building on what they're already good at instead of trying to start from scratch, recreating something new that maybe they don't have buy-in. Maybe that's not interesting to them. So that
Yes.
scaffolding is so important.
Absolutely. And it's the trickiest part. Also,
Yeah.
I'd say.
Yeah.
Is
It is so
in
tricky,
the
but I think
moment.
it's crucial in being neurodiversity affirming as well because it really it presumes a competence. It presumes that what they are bringing to the table is valuable. And if we are doing our jobs well, we are just adding to that. We are contributing and supporting that. We aren't trying to change that.
Absolutely. And you mentioned presuming competence, and I want to have a whole episode on what that is and why it's so important. And I just absolutely love it. And I just think we should talk about it for a minute, in your work and how you use presuming competence and kind of what your view is on that concept.
Well, I think I first had to unlearn some things, frankly. And that is because, like most people, I was trained, in a more traditional sort of pathology mindset about skills and deficits. And so I view diagnostic categories through a pathology lens. And so unlearning some of that and realizing it's not a less than, it's just a difference. And when you are able to first make that shift, then presuming competence is just the natural outflow of that shift. And that, of course, there's competence within each individual, even if it might look different than a neurotypical pattern or strategy. And I think, I feel so privileged to, with many of my clients and families, develop deep and lasting relationships where I really get to know people so well that
Yeah.
it would seem silly at this point to not know, to not see just the brilliance and the incredible capacity within the beautiful people that I have the privilege to work with. And so, I just see it like evidence of it again and again and again in my work that there is deep competence, even if it's different than a neurotypical pattern. And that's just the staple. I think that's just a real foundation.
Yeah, that's beautiful. It drives your whole decision-making process when you have that mindset and as a support person. And I think it's just so critical. And I know it's becoming more and more well known, but still probably needs to be even more discussed in our field.
Yeah.
So we still see it where that's what happens when that's not the mindset of the professional and, how detrimental it can be. And I'd love to talk about kind of environmental supports for individuals with PDA, if you have any, especially for professionals or parents, thinking about, in the environment and in RDI, I don't know if it's the same for in the neuro-relational framework, but when we're working with our clients, we want to create a focus on the relationship and the engagement opportunities. So we try to reduce a lot of the materials in the room so that we can focus on that relationship. Do you have a similar approach, or what do you suggest for families when they're working on these engagement opportunities?
So it is very similar. My office has a ton of stuff, but there's a closet and there's a cabinet and there's so it much more looks like a living room, except for the fidgets and the swing. Those are out and about. But I find that absolutely, if I had every single game visible, if I had every single art supply and Lego, I would be overstimulated, frankly.
Yeah.
So let alone individuals that I'm working with. So, I find that providing choices and selecting a few things is often really allows the relationship then to kind of be more in the center and more in focus. And the activity or the toy, it might be sort of the mechanism, but it isn't the sole focus, if you will. So, and beyond that, environmental supports, I think, again, it really depends on those individual differences. And that could look like, the type of lighting that an individual prefers. It could look like having white noise or background music or not. It could look like, having a lot of color, around in the room versus much more bland and kind of sterile. It can look like just think about all the different, components that make up our sensory environment, though there can be preferences associated with each of those that will either support, that green zone and that opportunity for learning and connection, or potentially cause a stressor and a trigger.
So that's just another layer of being that detective, kind of noticing your client's response to these things and what sets them up for success.
Absolutely. And there's worksheets that sort of go along with the neuro-relational framework to, tease out some of these triggers and then toolkits that support it, because it can be a lot to sort of think about and start sorting out. But I can give one little quick takeaway, and that is that if a parent is noticing, or provider or educator noticing a moment of green zone, let's say they just feel that connection, right? Often it's kind of those bright, shiny eyes. They don't have to be looking at you. It doesn't have to be eye contact,
Right.
but just that sort of brightness, that connection, you just can feel it often viscerally in your own body. Start noticing, take note, what's going on in this moment? Maybe jot down what time of day have they eaten? How did they sleep last night? What is the activity? How much movement has there been in the day? What's going on on a sensory level? Start being a detective, just taking 1 or 2 moments of green zone and noticing what is going on, being really curious. And then you can sort of be thoughtfully experimental, if you will, and see, can you recreate and foster more green zone by intentionally sort of creating and shaping some of these experiences. And so that's one way that, even without doing a big worksheet or a big, assessment protocol, that we can all sort of harness these tools and these ideas and maybe start making some changes that promote more connection, more regulation in our homes and in our classroom.
I love that. It's such a great takeaway, and it is manageable and doable. Not always easy for families to reflect, but so incredibly important. That reflection process is just such an incredible tool. And, I think it's so important to allow that time to sit back and reflect. And I know that's what we do as professionals as we're learning about our experiences and our clients with them and what worked well. And I just am so glad that you shared that. And I want to make sure that we also talk about communication styles for these individuals. Do you have, I know it's also individualized, and you've mentioned humor and, play. And do you have a style of communication you use or that you suggest for parents to use in your practice?
I'm a big fan of declarative language. So I would encourage your listeners, because I know you interviewed Linda Murphy, who is the absolute expert in that area and wrote the book on it, to listen into that show, because it really highlights the usefulness of this far better than I could. But in general, I think it's talking a lot less too.
Yes.
Which is hard. I'm a talker, but I've had to learn to really pare down how much I say, because my language can be like a fire hose at people, even if it's not my intention. Of course, it never is, but it can be a lot, and
Mm-hmm.
it can be a perceived demand as well, because often language is eliciting a response. And so
Mm-hmm.
my two shifts have been trying to employ more declarative language, but also just less language in general.
Mm-hmm. Yes, I love that. I know that's very, very like-minded. And we always say that I mentioned this with Linda when I went through, she's also an RDI consultant. And when I went through my training, we were told to give up to 45 seconds of processing time after you use that declarative language. And and oftentimes you don't need that much time, but it just illustrates that point of, allowing that brain to process that information and to respond in their own way, and given the space to do so, and I think that can be really empowering for our clients to have that chance and not feel overloaded. So,
Absolutely. Yeah. And it's hard to tolerate that pause and that silence, but I think it's really important. I can think of a really beloved client who often it'll be 60 seconds or greater before there might be a response. But what's really neat is now there's such a deep relationship. They'll acknowledge it and say, like, sorry, I was thinking about something else, and then kind of
hmm
respond. And that's often the
hmm
case of just that shift of mindset from what I might be talking about versus what they are internally thinking about and experiencing. It can
hmm
take some time to do that shift. And so being really quite patient.
yes, it pays off. It really pays off. And I think it fosters that trust too, that you're going to be someone that is not, I mean, inadvertently we may overwhelm our clients at times, but in general that we're not going to be a person that's constantly overwhelming their system. And that leads to that buy-in and desire to go towards opportunities as well.
Right.
So I'd love for our, parents listening, are feeling overwhelmed, feeling unsure. If you could share just one hopeful takeaway for them to keep in mind, one next step that they could do, I think that would be fantastic.
I think the most hopeful thing to do is to become a green zone detective. When I was working in South Central Los Angeles, it was really intense and challenging work, and I felt often totally overwhelmed, totally, yeah, just inundated with all the feelings and all the stress. And when I learned about the neuro-relational framework, it sort of gave me this grounding clarity. All I have to do is promote green zone. Regardless of diagnosis, regardless of what's going on in the family system, if I do that, I am doing my job.
hmm
And even though the devil's in the details and it's a lot harder, to
Yeah.
promote green zone, than it's just having that as a mantra for myself, like just go for green, go for green, go for green, really helped me stay steady and grounded in the cacophony of stressors that I was facing every day. And
hmm
so I want to share that with parents. And again, that's not to say it'll be easy or it will happen, but if instead of being like, oh, I need to work on this and this and this and this and this with my child, and there's all these challenges I have to tackle, and we're trying to overcome A, B, C, D, and E. Oh my goodness. I mean, I feel
Yes.
myself getting stressed just saying it, but I know that's what parents are feeling. They're feeling this overwhelming amount of stress with all of the shoulds and all of the things that are too hard right now. And
hmm
if we can just take a step back and shift and say, the only thing we're going for is promoting more green zone. That's it.
hmm
And if
hmm
that means 30 seconds more a day, that's great,
Yeah.
right? Some parents might be listening to this and say, well, Jessica, look, my kid is almost never in the green zone. You talked about those stress responses. That is 24/7 at my house. I
hmm
know. I hear you. I see you. You are the
hmm
families in my practice.
hmm
And I know that there are those small glimmers. I mean, it literally might be fleeting number of seconds where
hmm
there is just a flitting moment of green zone. And
hmm
that's what you're going to start noticing. And that's what you're going to start kind of deconstructing and thinking about. What are the components? Being curious, what might have helped create that 18 seconds of green zone. And then building on that. And so I think that has been a go-to principle in my practice that has been so helpful. And I hope that it is helpful and empowering for the families and providers listening as well.
It's beautiful. I think I always like to say, all these little moments, they're little moments that are going to add up to something big. It's going to be a big change in the end. And you said they build on each other. And so when you're focusing on those little moments, it's going to lead to a big change in the end. And it may take time, and everybody's on a journey at a different pace, and that's okay. It could be hard, but it can be done. And, I just love that message, and it's something that our families can really start to do and to focus on. And so I would love to have you be able to share how listeners can find you, or if there's other resources that you have, that would be great. I'm going to include all of those handouts that you mentioned as well, and your contact information in our show notes. But if you want to take a minute just to share any other resource that you think would be helpful for families or professionals too, that would be great.
Sure. So I invite people to follow me on Instagram. It's Jessica Richards, LCSW. And I post 1 to 3 times a week, little tidbits and pieces about applying this nervous system model to children and families. So hopefully that's something that might be useful. You can also check out my website as well. It's jessicarichards.lcsw.com. And then I want to encourage listeners, to reach out to nrfcare.org/starter-kit. And that's where folks can sign up and receive several of the NRF handouts for free, and also be signed up for our mailing list. I will say we only email out when there's a new product or training available. So we are not emailing daily, weekly, or even monthly, only when something new is coming. We are really excited that there is going to be a parenting book by the NRF that is coming out in the beginning of the year, as well as parent groups associated with that book. So if folks sign up for that starter kit, they will be the first to know when those opportunities become available.
Fantastic. Oh, wonderful. Well, thank you so much for this wonderful information. It was so helpful, and I'm so glad that we had a chance to connect. And I love what you're doing and what you stand for, and I think it's so powerful. So thank you for what you're doing for this field and these clients.
Thank you. And I so appreciate all the information that you are sharing out with people, because it can be so overwhelming, and you've really done an excellent job finding varied professionals to just convey helpful wisdom and guide people along the way.
Thank you. Yes, no, it's been a wonderful journey. I love the professionals that have come on thus far, and I am excited to see what's to come. So wonderful. Have a wonderful day. Thank you.
Thank you.
I'm dancing on the edge again. The wind is calling my name. I'm dancing on the edge again. This time I'm not looking back there. You can change me, you can tell me down. I'll leave echoes in every place I find. I'll break the mold with the rebels mind. I'm a hurricane of free, blowing mind.
The information provided on this podcast is for general informational purposes only. The content shared is based on the experiences, opinions, and perspectives of the hosts and their guests, and should not be construed as medical advice, diagnosis, or treatment recommendations. The discussions and topics covered are intended to foster understanding and awareness of autism therapies, but are not a substitute for professional medical guidance. Before making any decisions regarding therapies or treatments, we strongly encourage you to consult with a qualified healthcare provider who can provide personalized recommendations based on your unique circumstances. By listening to this podcast, you acknowledge and agree that the hosts, guests, and producers are not responsible for any consequences, damages, or outcomes arising from the use or application of any information during the show.